Okay, good evening, everybody. Thank you for joining us. I'm here with Christina Gavrelets.
Hi, everybody.
Christina is our nurse practitioner. She's our medical director, and she's a key member of our team here at MedAesthetics. So it's our first time having her on the live event. So we'll be should be talking about microneedling, PRP facials, and this vampire facial that people like to talk about, and that we are now providing. So let's hear how it works. So we'll start off. Oh, before we start, we will be asking some questions along the way. So stay tuned in because we'll have some fun giveaways along the way, and we're going to offer some great deal on services towards the end. So make sure you pay attention, and we'll do some surprise questions along the way. And if you do have questions, you can just put them in the chat, and we can address them towards the very end. Okay. So thank you again, and let's talk about microneedling, and let's hear how it works. So it all comes down to skin, and what we talk about a lot here at MedAesthetics is the key components of skin. So Christina, do you want to kind of go through what we talk about and what are the 5 key components?
Sure. So there are 5 key components of skin that we address here in our treatment. So the first is collagen, and collagen is the most predominant protein in the skin, and it provides our skin with structure and strength. The second most common protein found in our skin is elastin, and that's what provides our skin with elasticity and bounce. Our body's production of collagen and elastin both slow down in our 20s. And because of the size of the collagen and elastin proteins, it can't be applied topically.
So people are peaking at their 20s, right? It's all downhill from there?
It's all downhill from the 20s.
So from your collagen and elastin perspective, right?
That's right.
Okay, yes.
But
okay.
Don't lose hope because we're here to offer a solution to this. The third key component is hyaluronic acid, which is a water-binding substance that creates a fluid that fills the space between collagen and elastin. It retains moisture, leading to hydrated, plump skin, and it reduces the appearance of fine lines and wrinkles. Keratin provides a protective layer for the skin, and melanin determines our skin and hair color.
Okay, so remember this. I'm giving you a clue you may be asked later on. But if you ever come to MedAesthetics, you'll be hearing a lot about collagen, elastin, especially in our skincare lines. A lot of the lasers that we do are addressing this as well. So it's very important part of what we do. And this slide here talks about the signs of skin damage. Okay, so you can really see them here. We start off with the fine lines and wrinkles around the eyes, the crow's feet as they are called, lax and sagging skin. So you can just see that as we age. What do we call it? The inverted triangle. Yes, okay. So of youth, you have nice high cheekbones, and they seem to reverse as we get older, unfortunately. You can see melasma, so you get the pigmentation around your cheeks, hyper or hypopigmentation. The pores get larger, dull and even tone and texture, scars and stretch marks if you've had children or you've had scars or any surgeries through life. So this is quite a dramatic picture, but this kind of shows us the signs of aging, and there are things we can do to try to reverse it or reverse this process. So that's what we're talking about today. We're talking about microneedling, okay? And microneedling, in the medical literature, it's referred to as collagen induction therapy. We talked about collagen already and how important it is. There's been a lot of clinical trials out there that demonstrate the effectiveness, proving it's one of the best treatments to improve skin structure and appearance. So we're going to talk to you about it and how it works. Christina.
Okay, so microneedling involves creating tiny controlled wounds by pricking the skin with sterilized, atraumatic, surgical grade needles. And we do the treatment to a specific depth where we get pinpoint bleeding. And that's really important because that brings up the growth factors, and the body recognizes that it's damaged. And what it does is it triggers the healing process, leading to increased collagen, elastin, and we see the improved skin structure and appearance.
Okay, so our favorite words are collagen and elastin, right? Mm-hmm. Okay, so we use a lot of that, but this is what we talk about, the benefits of microneedling. Again, so you want to improve the elasticity, improve the texture, thicken the skin layers, reduce the pore sizes, improve the appearance of scars and stretch marks. So this is a lot of the benefits of microneedling. And we'll just talk about what happens when you come here. So what happens?
So you can see one of our beautiful relaxing treatment rooms here on the screen. So when you first arrive to our clinic, you're going to check in with our guest relations team. And next, you're going to be taken to one of these beautifully redesigned rooms. Topical numbing cream is applied to the treatment area and left on for about 15 to 20 minutes. Next, a personalized treatment will be performed by one of our qualified providers based on your skincare concerns. And finally, a soothing hyaluronic mask is applied to reduce swelling, redness, and inflammation. The procedure is very well tolerated, and our clients usually just report a feeling of vibration instead of pain.
Okay, so recovery and downtime, this is a question a lot of people will ask, and it is minimal, so that's important. Everybody knows that. It's a mild recovery process. We have some great recovery lotions if you want to maybe talk about some of those that we use.
Mm-hmm. So after the microneedling session, you may experience some mild tenderness, redness, swelling, flaking, and all of these typically resolve within a day or two. Here at MedAesthetics, we do offer great Neova recovery lotions that speed up the healing process.
Very good. Okay, so we're going to do our first pop quiz. If Parker is around there somewhere, we'll try to catch him. But the first person to answer this question correctly in the comments wins a $25 gift card for MedAesthetics. So, which of the following are important components of the skin? A, collagen, B, elastin, C, keratin, or D, all of the above? I'm sure you're all experts at multiple choice questions. I always go for all of the above, but I don't know if that's the correct answer here.
Yep, we have a winner. So we will DM E. Ferguson tomorrow to arrange a time to pick up the $25 gift certificate.
Okay, well done, E. Ferguson. Come on and pick it up. Okay, always go with D. Okay, so the next question is why should somebody come to MedAesthetics for microneedling? If you've heard of other clinics that provide it anywhere in Southwestern Ontario, what is it about our clinic that we think is the reason you should be coming and seeing us? So we like to think we are the premier medical aesthetic clinic in the Sarnia area. We're sure of it. And we have really the most highly trained medical professionals. So this is something that we find is very important. We have Christina, obviously. Christina has been a nurse for 17 years, a nurse practitioner, a lot of experience. We have five nurses working full-time with us. We have three medical estheticians. We have a great team. So we have a lot of depth to our medical team and our treatment team as well. We've invested heavily in technology, which is important. So not every microneedling device is the same. So it's important. We'll talk about the device that we use, and it's very, very important. And as I said, we've done a lot of research before we embarked on this. We spent months actually trialing different devices and deciding on the device that we were going to use. So we feel that we have the expertise, we have the knowledge, and we have the technology. And we'll talk a bit about the DermaSpark. And do you want to give us some background to it?
Sure. So the DermaSpark is the only microneedling device on the market that is licensed by Health Canada. It's medical grade. It has the fastest motor on the market. It's non-ablative, so there's very little damage to the epithelial level. There's optimal needle counts. The microneedler is electric, which is more consistent than a battery-operated device. And there's a foot switch, so there's no cross-contamination. So infection rates are very low.
Okay, great. So we're going to show you a video demonstration, and Christina, you might just talk through the process as we go through it. There was some sound to it, so we've taken the sound out, and the sound you're going to hear is Christina's voice.
Okay, so this is the Derma Stamp by Derma Roller, and it's really the gold standard on the market for microneedling. So again, it really induces collagen production, and it uses surgical grade microneedles.
Okay, so maybe just tell us what's happening right now. So
yeah, so you can see that
I've paused it just so you can have a look. Yeah.
The client is enjoying her treatment, and you can see she's nice and relaxed. She's had the numbing cream applied, so the procedure itself is very well tolerated. Yeah. Feels more like vibration as opposed to pain.
And start typically on the forehead and work our way down?
Yeah, we always start at the forehead. We do that area, then we work our way down the center of the face and then to each of the cheeks.
Right. And something that's great about the small pen is it gives some precision, especially around the crow lines or the crow feet.
Yeah, so with the microneedling device, we can actually get very close to the eye and around the mouth, which is something that you can't do with other treatments.
Yeah, so especially lasers, we have to be careful about eye safety. And so we can get kind of close to those areas, which is nice.
Yeah.
So we'll just continue applying it.
So we adjust the depth of the needles based on the treatment area and based on the end point. So what we're looking for is this pinpoint bleeding, which means that we're at the exact location in the skin that we want to be and that we're bringing the blood up to the skin and getting those growth factors stimulated.
Okay. I might just kind of go back. I think we show some before and afters during the presentation. But you can see some of them now here. So we'll just kind of talk about some before and afters from the use of this device for microneedling. So
yeah, so you can see with this particular client here, overall general improvement in the skin color and pigmentation, a lot of brightening. If you look around the eyes, you can see a noticeable improvement with those fine lines and wrinkles around the eyes, along the nasolabial folds, down into the chin and the marionette lines, as we call them, and overall improved texture in her skin.
So this one here is some classic acne scars you can see on the cheek. And I don't know if anybody tuned into our scar talk we did with Michelle, but this is a device that she loves to use as well. And you can see some of the improvement here in the skin, in the texture, in the color, in the depth of the scars. So this again is how this builds up the collagen, helps fill in some of these spaces. Mm-hmm. It's pretty impressive. Again, this is another before and after. So we want to talk through some of the improvements here.
So again, I see the noticeable improvement in the color, in those fine lines and wrinkles. A lot of clients start to develop those lines around the mouth that sometimes we call them barcode lines or smoker's lines. And those are really difficult to treat with other forms of treatment like injectables. And so this collagen induction therapy is excellent for those lines around the mouth.
Good. Okay, so we talked about microneedling as the first part of the presentation. We're now going to move on to microneedling combined with PRP, which is platelet-rich plasma. And people may ask what that is. So it really refers to the fraction of your blood that is rich in platelets. And platelets are, may know that they're used for clotting in your body, but they're also packed with growth factors, proteins, and other molecules that help with adhesion. We'll talk about how we actually go through the process. Do we have a chart after that? Yeah, so we offer the PRP as part of the vampire facial. So if you come in for this, the first thing we have to do is take a sample of your blood, and then we spin it in our centrifuge. So this is kind of step one. We'll have one of our nurses basically take the sample to begin with, and then it gets separated into different layers, and this is where we collect the platelet-rich plasma that is very rich in the growth factors. So why don't you just tell us what we do here?
Yeah, so next we use the actual PRP and we apply it to the skin and then we microneedle it into the skin. So when you do our standard microneedling procedure, we use hyaluronic acid as a guide to do the microneedling treatment. And with the PRP facial, we use the PRP in place of the hyaluronic acid. So with both treatments, we're stimulating those growth factors, but when we're doing just the microneedling alone, we're puncturing the skin with the microneedling pen. When we apply it transdermally, microneedling, the effects are amplified.
Okay, so we get partial, you get the very similar response, or you get the small holes, you get some growth factor, but it's like microneedling on steroids. Is that what we say?
Exactly.
Okay,
your results are just going to be so much better. Faster wound healing, better results.
Okay. So the treatment protocol, we typically do in batches of 3. Is that correct?
Yeah. So while some clients will have noticeable improvement about 3 weeks after a single treatment session, based on clinical studies and best practices, our recommendation is for 3 treatments, 6 weeks apart.
Okay, very good. And some scars and stretch marks may take more than 3, but your typical treatment package would be 3 that we do. So again, coming back to what can somebody expect, especially with a combined treatment, it always comes back to collagen. So increase your collagen production. reducing the wrinkles and fine lines, improving moisture retention, greater skin texture and tone, and tighter skin. So this is the real advantage for microneedling and PRP facials combined. Okay, so we're doing a pop quiz. So if people are listening, what does PRP stand for? So whoever answers this correctly first gets a $25 gift card. Again, what does PRP stand for? Is it platelet-ripe plasma, platonic-rich platelets, platelet-rich plasma? Please read the pamphlet, or please read pamphlet. So who do we have out there who's answered first?
We're just waiting on Facebook because Facebook's a little delayed. We're going to choose our Facebook Facebook viewer this time instead of Instagram.
Okay.
Okay.
All right, Brooke.
They just got in. See, so Kim Science.
Kim Seitz is the winner.
Okay,
All right.
Kim.
Congratulations.
Okay, Kim. So pop in tomorrow or the day after, and we will get you your $25 gift card. Great. Okay. So like everything we like to do, we like to show before and after. That's very important in this business, showing some of the benefits. And let's start with the first one.
Okay, so in this client here, you can see an overall improvement in the pigmentation and the color. Her skin looks really bright. You can see an improvement in her texture. You can notice an improvement in the fine lines around her eyes. And what I see most is the improvement in her nasolabial folds and the lines there around her mouth.
Yeah, so you can just see the improvement here compared to, or the improvement here compared to there. That's really what we can see. And again, with the needle, you can get right into those fine spaces. You can work around the eyes as well, very safely. So that's great. We'll talk about this one again.
All right. So again, overall improvement in her pigmentation. I see a noticeable improvement in her under eye area there, which is also one of our clients' main concerns often when they come in for consultations. You can see an improvement in the texture of her skin, and then again in the nasolabial and around the mouth.
Yeah. Okay, so we talk about the advantage of microneedling. So at the clinic here at MedAesthetics, we have lots of lasers, lots of different ways to treat, improve collagen, improve elastin. We have a lot of our creams, our serums. But what's important about microneedling is it's safe for all skin types. So not every laser is safe for every skin type. And what's very important this time of year, this is why we are doing the talk now, and not in the fall, is that it can be done all year round, but especially if you've had sun exposure. So anybody's had a laser here, BBLs, any treatments, you make sure you don't have an active tan. So no sun exposure 2 weeks before, and you need to make sure you're not getting sun exposure right after. This is something that's completely safe during the summer months, and if you are getting exposed to sun. So this is partly why we brought this on as well. So it's great that way. So a question people ask her, what's my options? What do I do? So we have two options really, right? So you want to kind of go through what we offer?
Yeah, so when you come in, we have the option of doing our standard microneedling treatment versus adding a PRP rejuvenation to the microneedling session. So what we like to do is have a discussion with our clients, find out what their concerns are, what their goals are, and really develop an individualized plan for their treatment. Both of the treatments will have the benefit of hyaluronic acid. So with the standard treatment, we use the hyaluronic acid as the slide during the procedure as well as the mask. And with the PRP facial, we add the PRP on top of that, plus the benefits of the hyaluronic acid. So both treatments are going to give moisture, improve that protective barrier, support healing, act as an antioxidant, and both will lead to smoother, softer, tighter, youthful, more vibrant skin.
Right.
But like we said earlier, the PRP is really just going to amplify the outcome for you.
Okay. And you can see you got a vampire facial, right?
Well, that's right.
Okay,
You
yes.
can take selfies.
Okay. So before we do this, I'm going to come back to that. We'll talk about the programs we have. So anybody gets any treatments at the clinic, you know, we've kind of changed things around a bit. We used to have the big sales twice a year, and we're trying to still have sales and promotions. We have them every month, but try to have sales that are available 12 months a year for our clients. So this is why we came up with the GEM membership program. It's a Sapphire program. Is you get 20% savings all year round on any purchases, product and services, as long as you're a member. And this is your own money. You're basically investing your own money. You're putting $350 aside, $349 per month aside, and you can spend that whenever you want, as you want. And when you do spend it, you get it at a 20% discount. So it's a great deal. If we are doing other deals on top of that, so if we do a bundle, for example, so sometimes we'll do a bundle, we'll give an extra 5% off. You'll be getting 25% off the price. When we do our promotions around Christmas time, 12 days of Christmas, as a Sapphire member, you'll be getting additional savings. So same with amethyst, same with jade. These are the stones of our children. That's how we came up with I have a daughter named Sapphire, so she got the Sapphire. So there's no fees, so it's a free program. You can stop whenever you want. So we also have a PayBright system. We're gonna come back to that one in a second. Yeah. So we have our PayBright system. So for clients who want to break down the cost of a treatment, you can do this almost even on the spot inside the clinic. It allows you to break down the cost of a purchase into a series of either bi-weekly or monthly installments. It's the #1 financing option in Canada. It was designed for plastic surgery clinics. And as an Allergan clinic, we're able to provide this option to all of our clients. So this is something a lot of our clients will look at as well. And it's very handy to use. So it's easy to sign up to. You just use a QR code in the clinic and you can be signed up. Coming back to our next pop quiz. So what are the 3 membership names? So we're going to answer, whoever answers first gets a $25 MedAesthetics gift card. So what are the 3 membership names? Jade, Amelia, Sapphire, Joan, Amethyst, Sapphire, Jade, Alchemist, Centrifire, or Jade, Amethyst, Sapphire? So we'll wait to hear who has the answer.
Oh, E. Ferguson, you already won one. So
Okay.
You're paying great attention now.
Jackie Moniz.
You have Jackie Moniz. I have Tracia 003.
Okay.
So
Well, you know what? We'll give them to both. Okay.
Oh, you're so generous,
Okay,
John.
Okay. So who are those names again?
Tracy A 003
And Jackie Moniz.
Okay. So ladies or men, a bonus. Okay. So you guys can come in and pick up your gift cards tomorrow or the day after. Okay. So something else, I'll be doing another talk on PRP for hair loss. So we've done a lot of research in this, and we have experience in PRP for hair loss. I've done a lot of work with hair loss in my own practice, doing injections for that as well. So we'll be bringing that to MedAesthetics, and we'll be doing a talk on July 6th. And tune in, male, females who have any hair loss, androgenic hair loss. It's gonna be a great night and a great conversations, hopefully. So we want you to be able to ask questions, but before we do that, so after this clinic, after this talk tonight, if you guys want to sign up, you can sign our contact form. We will get in touch with you tomorrow. By signing this form and scheduling an appointment, we'll also give you a $50 MedAesthetics gift card. So anybody who signs up, call in and book an appointment, you get a $50 gift card, which is another advantage. If you're following on Facebook, Instagram, you can use the QR code here as well. Okay, so fill out your forms and get access to the MedAesthetics gift card. So now, for the time we have left, we will answer any questions if they are out there.
We've had a couple of questions asked during the duration of the webinar. So one of the questions the client wants to know is, can you do this procedure on the neck?
Yes.
So it's great. So
we're glad that you asked because we didn't mention that. So we can do the treatment on the face, on the neck, on the décolleté, and we can also do it on the body. So we have clients that have scars or stretch marks or just areas of concern on their body that we can treat as well.
what is a décolleté for those who don't know?
The décolleté is the chest area here that seems to get a lot of sun on a lot of people, and it's a really area where we get pigmentation, we start to see fine lines and wrinkles, and it's an area of concern for a lot of our clients.
Okay, so it's a new word for everybody's vocabulary if they didn't know it already. Décolleté. Okay.
Is there an age restriction?
Well, for all of our treatments, we like to wait till a client is over 18, but there's no upper age restriction at all. We've had women in their 80s. We may even have a 90-year-old coming in quite soon. So it's 18 and above.
Yeah, so 18 and above, men, women, and really clients with all skincare concerns should book an appointment and a consultation to see if they're a good candidate.
Yeah, as always, we'll do a complete history physical. ensure that the client is appropriate, make sure there's no contraindications, certain blood thinners, etc. We have to be more careful, especially taking your blood. But yeah, there's no way. That's part of why you hopefully come here to get your treatment, is that you'll be assessed by either Christina or myself or one of the 5 nurses we have here every day.
All right. So, how long do the effects last after you've had the 3 treatments done, and what is the maintenance program after 3 initial corrective treatments?
Yeah, so we typically recommend that people do some sort of collagen induction therapy, whether that's microneedling or laser treatment, anywhere between every 12 to 24 months, just to keep that collagen and elastin production stimulated.
Yeah, so typically you'll have your 3 treatments, and then after that is sometimes an annual treatment that you'll have.
Yeah.
Depending.
All right. So who's a good candidate for this treatment?
Mm-hmm. So really, like we said, we think almost everyone is. There are certain contraindications to the treatment, things like clients who are taking blood thinners or other medications. Anyone that has active acne, this isn't for you. So once the acne has resolved and you want to treat some of the color and texture issues, we can do that with good results, as you saw. Other things like active cancer treatments like chemo, radiation, things like that. So like John said, we'd like to see you to do a full health history, physical exam, make sure it's the right treatment for you.
Yeah.
So how long is the treatment from start to finish?
Yeah, so for a treatment on the face, you can expect to be here for about an hour. So the numbing is about 15 to 20 minutes. The treatment is about 20 minutes. And then that soothing mask afterwards is 20 minutes.
It's slightly longer if you're getting the vampire facial. So we have to draw your blood and spin it and apply it. So that's probably more like an hour and a half, I would say.
Yeah.
Hour and 15 minutes, an hour and a half for the face, but longer for the neck and chest.
Yeah. And as you add on more body areas, the time goes up.
Yep.
Does this treatment pair well with injectables, or what other treatments would you recommend to use in combination with microneedling or PRP?
Absolutely. So we take a holistic approach for all of our treatment plans. So we like to recommend a combination of topical treatments to treat the skin from the top down, as well as in combination with dermal fillers, neurotoxins, as well as our laser options for collagen induction.
Yeah. Yes, we're very fortunate to have all the technology we have here. And it depends on the year. I mean, this is something great to get started in the summer for people who are kind of waiting to hold off until October or November or September for some of the lasers. If they want sun exposure this summer, they can get started right now on some collagen induction over the next few months.
And what is the approximate cost of the treatments?
So it depends. So if you're talking about the facial, it's $350 for the actual facial and above. For the vampire facial, probably $650. But like everything, we do them in combination. So if you buy a package, there's a discount right away for a package. We put a 5% discount off the top if you buy 3 at a time. And then again, you can add on your Sapphire, Amethyst, or Gem membership. So if you were a Sapphire member, you're going to get 25% off that price. Amethyst member, you get 20% off in total. And then for Jade, it's 15% off. So we always do great packages and great deals. That's why we encourage people to join the membership, because it is free and you get the automatic savings. So,
can you treat the arms?
Yes, we can.
Yeah.
Yeah.
Yeah. No reason not to.
Yeah.
Yeah.
Yeah, we definitely could.
Excellent. I think that's all for our question and answer period right now. No other questions in the chat?
Can you have a tan on your face?
Yes, that's why. Yeah, that's a great question. That's why we're doing this. We kind of move this talk forward because we want to catch people, to tell people that there are treatments you can get during the summer, during the tan months, the months you're getting tans. You can get it when you come back. If we're traveling again at Christmas and March break, again, you can still come back and get your treatment. So that's something we're really excited about, and we're available all summer for them.
Mm-hmm.
So if you have more questions and you want a consult, again, fill out the form. There's a $50 gift card for people who filled out and book an appointment. You can come in, you can see any of our team, call us. Cassie will do consults. We have an optic elite, and we can do some more certain in-depth skin analysis as well. So we invite everybody to, if you haven't been to the new clinic, to check it out, especially obviously during COVID restrictions. We're very careful with that as well, but as soon as they're lifted, we hope to see you soon for these treatments.
Yeah, so thank you for joining us. It's been a pleasure, and congratulations to our winners tonight.
Yep, and we'll see you hopefully on July 6th, is that our date, for PRP hair loss. Okay, we'll be back then. Thank you.